In the context of healthcare entrepreneurship in India, non-compliance with regulatory requirements and industry standards can have significant legal, reputational, and financial consequences. So here's a comprehensive overview. Legal repercussions, that is non-compliance with laws such as Drugs and Cosmetics Act, the Medical Council of India Act, and the Clinical Establishments Act can result in legal penalties including fines, imprisonment, or both. So patients who suffer harm due to negligence or non-compliance with medical standards can file medical malpractice lawsuits against healthcare providers and hospitals or entrepreneurs. These lawsuits can lead to substantial financial damage and damage to the reputation of healthcare enterprise. Loss of reputation, negative publicity, loss of accreditation, financial penalties, fines, loss of revenue, all of this can have a significant impact on financial sustainability of healthcare venture. So to mitigate these consequences, healthcare businessmen or entrepreneurs in India must prioritize compliance with regulatory requirements, industry standards, and ethical practices. This involves staying updated with the latest regulations, implementing robust compliance systems, and fostering a culture of compliance within the organization. So these challenges can affect not just you as an entrepreneur, but also patients, employees, and healthcare industry as well. Now, here are some practical tips and strategies for staying informed about the regulatory changes. Step 1 is monitor government websites and publications. So regularly visit the websites of Ministry of Health and Family Welfare and CDSCO, that is Central Drugs Standard Control Organization, and other relevant government bodies to access the latest notifications, guidelines, and circulars. Subscribe to their newsletters and email alerts to receive updates directly in your inbox. Step 2 is to attend industry events and webinars. So participate in conferences, seminars, and workshops organized by healthcare associations, industry bodies, and regulatory authorities. Attend these webinars and online events also to gain some insights. Step 3 is network with healthcare professionals. So connect with doctors, nurses, pharmacists, and other healthcare professionals to gain some practical insights into the impact of regulatory changes on their work. Join some professional network also, online forums. You can do all this. Step 4 is follow healthcare news sources. Read some reputable healthcare news websites, journals, and magazines to stay informed. Follow some healthcare journalists and influencers on social media to access some real-time updates. Step 5 is to engage with regulatory bodies. So attend public consultations and stakeholder meetings organized by regulatory bodies to provide feedback and suggestions. So contact regulatory officials directly to clarify doubts or seek guidance on specific regulations. 6 is to seek some legal or professional advice and consult with legal experts on healthcare law to ensure compliance and complex regulations. Engage with them, and they are the ones who will be providing you with tailored solutions. Step 7 is to stay updated with the latest regulatory changes through online courses, workshops, and certification programs. Encourage your team members also to undergo some relevant training to enhance their understanding of regulatory requirements. So by implementing these strategies, healthcare entrepreneurs in India can stay informed. I invite you to join my exclusive webinar series where I delve deeper into these challenges and offer tailored solutions. So these webinars address your fears, anxieties, your pain points, equip you with the knowledge and tools to launch your healthcare venture. Click the link below in the description to register and start your journey towards a compliant and thriving healthcare business. Remember, compliance is not just a legal requirement, it's a cornerstone of trust and quality in healthcare. By embracing these strategies, you're not only safeguarding your venture, but also contributing to a higher standard of healthcare. So join me in this endeavor to make healthcare compliance less daunting and more empowering. So register for the webinar and let's embark on this journey together. Goodbye.